Sometimes teeth are lost, for one reason or another. Although a lost tooth is never replaceable naturally, there are options to correct the problem. One of these options is a bridge. Other options are an implant or a partial. In the absence of a tooth in the empty space, neighboring teeth can move to fill it in. They can push in from the top or bottom, or tip in from the sides. A bridge will prevent this from occurring while providing a new tooth to chew food and make your mouth whole again. A bridge consists of both a false tooth, called a pontic, and the anchors that support the pontic. The entire structure spans the space vacated by the missing tooth. To make room for the bridge, the teeth first need to be prepared. An equal amount of structure is removed from each tooth. An impression is taken and sent to the dental lab where the bridge is built. The structural part of the bridge is created with a strong metal alloy that can handle the anticipated stresses. Tooth-like porcelain is then fused to the structure. Once the fit of the bridge is tested and assured, the bridge is cemented to the teeth. At home, it is up to you to take care of your new bridge. It is particularly important to clean the space under the bridge. Flossing helps clean away destructive bacteria. A floss threader must be used since the bridge is solid. With proper care of your bridge, including brushing, flossing, regular dental hygiene, and checkups, a bridge can last for many years and can restore that whole mouth feeling. Bruxism, which is the clenching and grinding of the teeth, can be one of the ways in which we deal with the everyday stress of our busy lives. While most bruxism occurs during sleep, we may also find ourselves clenching our teeth during the day. Early management of this condition is important because of the potential for permanent damage. Many patients experience only minor damage as a result of bruxism because they grind their teeth infrequently. More severe grinding can lead to jaw muscle pain, headaches, tooth sensitivity, premature tooth wear, loose teeth, and temporal mandibular joint disease, commonly referred to as TMJ. Bruxism is often the result of stress. When our muscles are overworked during clenching and grinding, pain and tension result. The areas that can be affected are the jaw muscles, temples, and just behind the ear, as well as the entire head and neck. Specific muscles are used to move the jaw during normal chewing. When clenching and grinding occur, these muscles do not function properly and become strained. The strain can produce muscle knots, inflammation, and pain. The goal of any therapy for bruxism is to reduce the symptoms or perhaps alleviate the behavior altogether. Bruxism can be made worse by poor sleep habits, often caused by high caffeine intake, poor stress management, incorrect bite, and drugs. Muscle pain reduction therapy may involve massage, hot and cold compresses, and stretching exercises, and may include muscle relaxants, anti-inflammatories, and steroids. The recommended treatment course is determined by your dentist according to your specific symptoms. Your dentist may also prescribe a night guard for you. The night guard can unload your jaw joint of stresses and will continue to train your muscles to relax during the day, as well as eliminate tooth wear during grinding. Many factors affect whether or not bruxism is a constant problem. Many of these factors can be easily changed, while others can be more difficult or impossible. The result of positive bruxism treatment can be a stable mouth with reduced stresses both in mind and body. Cavities are the most familiar problem that people experience with their teeth. Fillings are the most common procedure for correcting that problem. Your mouth is a busy place. Around your teeth swirl bacteria, tiny colonies of living organisms, some good, some bad. There's saliva too. saliva is good. It helps to maintain the hard outer covering of your teeth called enamel by contributing mineral salts and controlling acidity. Cavities usually develop because of improper cleaning of those hard-to-get-to places that normally need flossing. By their nature, these places are also the hard-to-see places in your mouth, so the cavities are often not easily visible. When bacteria combine with food particles, they form plaque that adheres to your teeth. As they eat up sugar, the bacteria produce acids that dissolve the minerals that help make tooth enamel hard. The enamel softens, the tooth surface gets porous. Tiny holes appear in the enamel. The acid continues to attack. The tiny holes become bigger and combine to form one big hole or cavity. As long as the plaque remains, the acid produced by the bacteria will eat away the tooth structure. Once through the enamel, the acid attacks the dentin, which is that part of the tooth containing sensitive nerve fibers. The nerves can send out signals of sensitivity and pain, which indicate a problem. If the tooth decay reaches the dentin, a filling is needed to halt the degenerative process. Otherwise, it continues at an accelerated rate. If the cavity gets too large, it can damage the nerve. If it is found soon enough, it can be repaired by a simple preparation and filling. After the damaged area of the tooth is removed, a filling is done. With this filling in place, the tooth is restored to its original contours. Afterwards, it should feel natural and comfortable. After a particularly large filling, it might take a little longer for that area to feel normal again. Eventually, though, you shouldn't notice anything at all. If you do, you need to have the tooth checked again for other problems, such as rough edges or incorrect bite. If taken care of, a good filling should last for many years. It's even possible that it may last your entire lifetime. Conservative fillings have the best chance of long-term life, so the sooner the cavity is repaired, the more tooth structure can be saved. The least expensive, easiest, and healthiest way to maintain your teeth is by keeping them clean. Whether performed at home or at your dentist's office, cleaning your teeth is an essential part of maintaining a healthy mouth and body. The most common enemy in the battle to keep teeth clean is plaque. Plaque is a sticky substance that attaches to teeth. It is composed of various components, including bits of food and bacteria. The accumulation of plaque depends on factors such as tooth shape, oral environment, types of food, and salivary flow. When plaque is allowed to stay on your teeth for an extended period of time, it can create problems such as gum irritation and cavity formation. It can also lead to more serious conditions such as periodontal disease. Frequent brushing and flossing is very important to diminish the possibility of these problems occurring. Brushing is a simple and easy way to remove plaque from visible tooth surfaces. Proper brushing technique involves a little thought and diligence, but the rewards are many. First, the toothbrush must be soft. Hard bristles can cause injury to the gums and can prematurely wear the enamel and dentin. Choose a brush that feels comfortable in your hand with a shape that allows you to clean the areas of your mouth that are difficult to reach. A toothbrush with a compact head is often able to reach areas a larger one cannot, and a smaller one provides better control and feedback. Your toothbrush must also be in good condition. Bent bristles hinder good toothbrush control. When your toothbrush shows signs of wear, replace it. Once a good toothbrush has been found, it's time to brush. Have a plan in mind where you start and end your brushing. An effective system may include starting on one side of your mouth and moving to the other, or moving methodically from the middle to the back. What is important is that you are consistent with your technique and that all the areas are reached. Begin by placing the toothbrush at a 45-degree angle to your teeth at the gum line. This allows the bristles to clean under your gums as well as some of the areas between your teeth. Then start making small, soft circles with the brush, creating a polishing motion. Slowly move from tooth to tooth, giving each enough time to be fully cleansed. A typical brushing should take approximately 2 minutes to complete, if done correctly. Remember, the longer the toothbrush is in your mouth, the more thoroughly it will get your teeth clean. When you transition from one hand position to another, be careful not to skip over teeth as you move. Pay attention to cleaning the inside surfaces of your teeth, and be especially diligent in reaching behind the back of your back teeth. If you feel that your technique for toothbrushing is not adequate, you may want to consider using an electric toothbrush. A well-designed electric toothbrush can do a great job of cleaning your teeth and, over time, may even reduce gum pocketing. Once the teeth are cleaned by brushing, it is time to clean the critical spaces between the teeth by flossing. There are many types of dental floss available. The floss you use should be comfortable for you and should be able to successfully remove the plaque from the areas between your teeth. Begin by pulling about 18 inches of floss from the container. A short piece of floss will be difficult to use and ineffective. Get a good grip on the floss. One very good way is to create an anchor for the floss by wrapping the floss gently on your middle fingers. The index fingers and thumbs are then used to place the floss between the teeth. Using a slow and gentle back and forth motion, move the floss through the tight area where two teeth touch one another. Once you have passed the tight spot, do not continue with any sawing motion, because doing so can create cuts in your gums and even damage your teeth. The floss can now be positioned against the side of one of these teeth. Make a wrapping C shape around the tooth and gently move the floss up and down, wiping the plaque from the side of the tooth. When the side of one tooth is clean, move the floss up and over the gums to the neighboring tooth. Push both ends of the floss back to create the C shape again, and use the wiping motion to remove the plaque from the other tooth. With careful home cleaning, your teeth and gums have the best chance of staying healthy. Even with proper home care, it is still possible to miss areas of your teeth. These are the areas your hygienist will need to clean during your next scheduled office visit. If plaque is left in the same location for a long time, it hardens into calculus. This calculus must then be manually removed with special instruments designed for that purpose. Once it is confirmed that all of the soft and hard deposits are removed from your teeth, your hygienist will polish your teeth to make them very shiny and smooth, further defending against plaque buildup. Regular checkups by your dentist are always necessary to assure that no other problems exist. With proper home care and regular office cleanings, your teeth can enjoy a long and healthy life. Sometimes a fracture or other damage to a tooth is so large or has so weakened the tooth that a filling cannot repair it adequately. In these cases, to prevent further deterioration and to restore tooth quality, the healthy remainder of the tooth can be made whole again by fitting a crown onto it. Tooth damage can be from a variety of causes, often a cavity, fracture, broken tooth, or a combination. A crown serves to replace the tooth's original enamel covering and to provide strength. There are three basic types of crowns: a porcelain metal crown, a pure porcelain or composite crown, and an all-metal crown, usually gold. They differ in durability, strength, appearance, and cost. No matter what type of crown is chosen, the tooth first requires preparation. There are several stages of tooth preparation. An initial problem may be that the tooth may not have enough structure to support a crown. Additional bulk can be added with a filling called a crown buildup, which provides a strong, stable foundation. The next stage of the procedure is to shape the tooth to support the crown. First, an outer layer of the tooth is removed. An impression is then taken from which the crown will be built. Once built, the crown can be cemented onto the prepared tooth. The porcelain metal crown takes advantage of the best of both materials. The metal provides a strong base, and the tooth-colored porcelain offers a pleasing and natural look. However, when fused together, they are thicker than a metal crown, so more tooth removal is required. The porcelain metal crown can look fairly natural if the edge where the crown and tooth meet are hidden below the gum line. However, sometimes a small sliver of the metal base is exposed. A porcelain margin can be added to replace that metal edge and match the tooth. Crowns can also be made of tooth-like pure porcelain or composite. An all-porcelain crown can have the look of a totally natural tooth in both color and translucency. The porcelain or composite crown is the most fragile and thus limited to where it can be placed. Areas likely to be subjected to strong forces of compression, such as molars or other posterior teeth, may need to use a porcelain metal or an all-metal crown. The third crown option is metal, often gold. As the strongest material of the three choices, less of it is needed to form the crown and less tooth removal is required. Metal crowns are the most durable. However, they may conduct heat and cold and may irritate sensitive teeth. A crown should feel and function as a normal tooth, and porcelain crowns can even look completely natural. If you give your crown the same care you give your natural teeth, it should last for many years. Keep in mind that the most susceptible part of a crown is where it meets the tooth, so take care that plaque does not stay on this area for any length of time. Gingivitis is the most common gum problem that plaque creates. Under normal circumstances, healthy teeth and gums help clean themselves. Healthy gums are tight against the teeth and do not provide much space for plaque to get trapped. However, when food gets in the nooks and crannies of your teeth and gums and is not removed often by brushing and flossing, it becomes plaque.